Okay, hello everyone and welcome. I hope this finds you well and you are ready to learn a little bit about the University of New England and our nursing program. So my name is Alyssa Chowdhury and I am one of the assistant directors for undergraduate admission here at UNE. I am really excited to kind of get to know a little bit more about our program tonight. We'll go through a short presentation and then have some time for questions and answers. So hold those till the end and we will definitely get to those. But we're going to start out tonight. I just want to let you know that here in Southern Maine and in New England in general, we are experiencing a bit of a nor'easter. Funny how that should happen. So the winds are quite they're whipping tonight, as we say here. So there's a small chance that one of us may lose power or internet during our chat tonight, but we'll do our best. So please don't be alarmed if someone pops off quickly. So like I said, my name is Alyssa. I'm a member of the admissions team here at UNE, and I would like to throw it over to Dr. Jen Morton to introduce herself and the rest of the folks we have with us tonight.
Hi, everyone. My name is Jennifer Morton, and I am the program director for the nursing department. And we are very fortunate this evening to have two of our students with us, as well as Professor Donna Hyde, who is our assistant director for experiential education. She's going to be able to talk with you a lot about the simulation and the clinical education here at the School of Nursing and Population Health. We also have Taylor, who's a UNE senior, getting ready to graduate. And we have Matt, who's a UNE junior, ready to leave his junior year and head into his senior year. So as we think about the nursing program here at UNE, we are a fairly large program that's home to two types of nursing education. And one of them is the traditional four-year program, which my understanding that you are all considering where it is that you will attend nursing school. We also have an accelerated baccalaureate degree, and that is for students that have a prior bachelor degree in something else. Our traditional four-year program is our largest program, and we're really proud of the successes that we have with that program. This person that you see on your screen right now is our wonderful dean of the Westbrook College of Health Professions here at UNE. Karen Pardue is a nurse by training, but she oversees over 13 health professions programs here at UNE. And so we're very lucky to have her as our leader, and she has done amazing things to grow programs at UNE. The nursing program in particular has tripled in size in the last 5 or 6 years. We're very lucky that we have two campuses that are in the United States, in the state of Maine. And nursing students have a really interesting model here at UNE. They spend 2 years on the Biddeford campus, and they also spend 2 years on the Portland campus. Those two campuses are separated by about a half hour, about a half hour. And the Biddeford campus is where nursing students start. They tend to be on campus, and they have that real community of being in clubs, having clubs in dorms, and the real UNE community feeling. The Portland campus, when students move up to the Portland campus, they still have the option of living on campus in Biddeford, but many choose to live off campus. The Portland campus has a real professional feel, and when nursing students leave the 2 years in Biddeford and move up to campus, it becomes much more of a delving into the major kind of feel, and they also are learning alongside a lot of graduate health professions and programs. And so the lovely coast of Biddeford, the Biddeford campus, and then a little bit further north to the lovely coastal Portland campus, although Portland it's in the greater Portland area. So on the Biddeford campus, where students spend the first 2 years, are the College of Arts and Sciences, where our nursing students take all of their foundational coursework. So that would include the lab sciences, the social sciences, English composition, and some elective coursework for the true foundational needs that a nursing student needs to have. They also have their first 2 nursing courses while they are on the Biddeford campus. That campus also houses our College of Osteopathic Medicine. And then on the Portland campus, we have the College of Dental Medicine, the College of Pharmacy, and the Westbrook College of Health Professions, where nursing students spend their time along with the dental hygiene program and many of WCHP, as the acronym, multiple graduate programs. So this is just a little snapshot of our simulation lab and some of our students in action caring for a patient with complex health needs. So you can see with the technology that's available in our state-of-the-art simulation lab, students are able to simulate very authentic patient experiences. And that's a really safe and wonderful place for students to learn the profession. So our undergraduate programs in the health professions include nursing, dental hygiene, athletic training, applied exercise science, a major called health, wellness, and occupational studies, which is a pre-OT or pre-occupational therapy degree, public health, nutrition, and social work. And then graduate programs, and these are all on the Portland campus. Nursing students will have an interface with those graduate programs, include nurse anesthesia, physician assistant, physical therapy, occupational therapy, social work, master's in public health, and a master of science in athletic training. We are the largest educator of health professionals in northern New England. And so having all of these health professions programs on one campus allows us to really emphasize the importance of working alongside other health professionals, and that's called interprofessional education. And it's one of those things that's really important to look for as you decide on the nursing school you want to attend, because interprofessional education is something that employers are looking at, that nurses bring into potential jobs. So our Portland campus is really beautiful. It's in the heart of Portland, Maine. And if you haven't visited Portland, Maine is a very exciting place. We have Matt or Taylor really speak to that, because I'm sure they've explored Portland in great detail. Matt, do you want to speak a little bit about Portland?
Yeah, Portland's a great little city. It's really known for their restaurant scene. There are so many really good restaurants in Portland that me and my roommates really like to explore. I currently live in Old Orchard Beach, so I commute to Portland from there, but we go to Portland all the time for all really good restaurants and a lot of really fun things to do. I know Taylor physically lives in Portland, right down the street from campus, so I know she really likes living there as well.
Great.
Yeah, I've lived in Portland for 2 years now. It's right near campus, and there's always stuff to do. It's a nice city, nice college city too.
Wonderful. Thank you. And so the Portland campus is fairly it's fairly small, but it's very quaint, and a lot of brick buildings, very beautiful buildings, and it has a very New England feel to it. There are some buildings on the Portland campus. The Blewett Science Center is actually where the School of Nursing and Population Health is housed. So that if you see that second floor there, that's where all of the nursing faculty offices are. We're all in one central place, so students can readily find us. again, this is one of our newer buildings, the Interprofessional Simulation and Innovation Center. And that's where our new state-of-the-art simulation lab is housed. And we're going to have Professor Hyde and the students talk a little bit more about that later in the presentation. So this is the beautiful Biddeford campus, which is right on the coast of Maine, southern Maine. So students have a bird's eye view of this beautiful ocean view. And the campus is a little bit larger than the Portland campus. And again, beautiful buildings and beautiful scenery right on the coast of Maine. More of the Biddeford campus. This is the new Rippich Commons building. This building was named after our former president of the university, Danielle Rippich, and it's a beautiful, beautiful state-of-the-art building. A little bit more with our students, a real sense of community. Biddeford is, the Biddeford campus has a very robust marine bio program. And so we see some students out here enjoying paddleboarding, but there are ocean programs that are also part of the academic network here at UNE. UNE is Division III in sports, and we believe opened our second season of football last fall. I may have to have one of the students confirm that. But a new football program, new successful football program that's growing leaps and bounds and bringing students into that to UNE to enjoy. But wonderful new program, along with many other Division III sports programs. So here we are again in the Interprofessional Simulation and Innovation Center. And you see a group of nursing students here working with a clinical instructor and a faculty member caring for a patient with some complex needs. This is a very unique model of educating students in an experiential way. And students at UNE spend about 15% of their time in the simulation lab. What's really interesting about simulation is we can simulate experiences that are that students probably wouldn't see in the clinical setting, because we might not give a student a patient that is that sick, and we might not have the opportunity. So simulation is where we can have patients exhibit complex health conditions, and students can take care of those patients in a safe environment and not hurt themselves or hurt the patient or themselves at the same time. And so students really love simulation. We have faculty that are very highly trained in simulation, and the Simulation Center itself has a staff and a director that are also very highly trained. It's a marker here at UNE that we're very, very proud of. So when we think about interprofessional education, and remember earlier in this presentation, I talked a little bit about how it's something that employers really look for, and it enables our students to leave the nursing program to really confidently work as part of a healthcare team. We have 3 courses that are taught in the first 2 years that have to do with interprofessional education. And we also, again, have all of our simulation experiences that take place in the Interprofessional Education Center. And we are an international leader in simulation education, as well as interprofessional education. As you can see, our students, Matt's in this picture, I see, wearing their UNE scrubs. Looks like they're either leaving a clinical experience or getting ready to go to one.
That was right after our first clinical last. So.
Wonderful. Wonderful. So what makes UNE's nursing program unique and, in my mind, very attractive is that we are a direct entry program. And what that means is that when students are accepted to UNE's nursing program, they're accepted as direct entry students, meaning they don't have to ever reapply as long as they maintain the benchmarks that are set for the program. That student will be assured a clinical placement in their junior year, and they will be able to finish the program in the prescribed amount of time, which is 4 years. Not all programs can say that, but we're very proud of that. We have enough clinical placements in this area that we are not directly competing for clinical slots. We have them. Our requirements entering the program and for anyone who maybe hasn't applied yet, we require students that are applying to have a GPA of 3.2, recalculated for math and science, as well as either a 1080 SAT or a 22 to 23 ACT. Like I said earlier, 2 years on the Biddeford campus, 2 years on the Portland campus. The program is 120 credits, and we have approximately 600 hours of clinical training time. The Maine State Board of Nursing doesn't have a specific requirement on what the amount of clinical hours that students need to have to graduate, but we're on the generous side because we believe that the more clinical students have, the more confident they're going to be in their clinical skills when they leave our program. And that those clinical hours include a 135-hour culminating preceptorship. And that is at the end of the curriculum, students spend about 4 full weeks with an RN out in a clinical setting that we try to match up with their level, with their areas of interest, and that they're working alongside an RN as a nurse for all, for lack of a better description. And that 135 hours culminating preceptorship is what students will say was really the aha moment where they became a nurse. So classroom experiences, this is actually an experience that's not in the simulation lab, but in the skills lab. And you can see some equipment on the bed and some equipment on that bedside table. That is where students are being instructed to do specific nursing skills. And the students have to meet specific competencies in executing those nursing skills before they can go in to the clinical environment and do that with a patient. So all nursing schools have skills labs as well as simulation, and they're really, really important milestones in a nursing education program. Professor Hyde, did you want to say anything more about the skills lab?
So the skills lab, or welcome everybody. The skills lab is incorporated with each clinical experience. We bring students in at the very beginning prior to starting their clinical session, regardless of what level that is, because we bridge those skills dependent on the level of the clinical experience. So we have 3 separate med-surg type, we call them adult health. And so prior to each one of those, students will come in and do select skills and assessments for that. And we also have them for the maternity and pediatrics rotation as well. So there's plenty of time in the skills lab, and we always offer the available ability for students to come in for open lab if they desire and want some extra training or things like that in addition to the skills lab that we do.
Great, thank you. So our classroom experiences are very innovative and state-of-the-art. We do a lot of active learning. We do a lot of case-based learning. We do one-on-one. We have a really interesting program now in our simulation lab where we actually have virtual reality simulators where students are wearing the goggles and actually caring for a patient through virtual reality. My understanding is that we are first in the United States to roll out this technology, where we have some company now, but we were the first to roll that out. And we're really excited. The students have really been enjoying it, and it's really raised the bar on the technology focus of nursing education. We also have seminar types of classes too. And so our clinical experiences, we have clinical experiences at many hospitals, community-based settings, and clinics in the greater Portland area, really a radius of about a half hour from the Portland campus. And this is Maine Medical Center. This is Maine's largest tertiary care center, about 600 beds. And all students will spend a little time here. Other sites include Mercy Hospital in Portland, Southern Maine Healthcare down in Biddeford, York Hospital, which is in the York Kittery area, Mid-Coast in Brunswick. Spring Harbor is a mental health hospital in Portland. New England Rehab is where students spend their first clinical rotation. Also some long-term care centers, a community-based federally qualified health center called Greater Portland Health, and Core Health, which is home health care for fragile pediatric patients. Again, another skills lab experience where it looks like students are, maybe you can help.
Looks like they're putting in an NG tube, a nasal tube, and
still measuring it, maybe.
Oh, yeah.
So again, another situation where students practice a skill like inserting a nasogastric tube before they would actually be doing it in a clinical setting. And so, Professor Hyde, I'm going to turn this over to you to talk about the safe environment for implementing these skills. And then maybe Taylor can tell us a little bit about her experiences.
Sure. So in the skills lab, what we tend to focus on are basic skills initially, and then again, they're tiered depending on the development level and the course levels that the students are in. It's very important to us when we look at the skills lab environment, as well as the simulation lab, that we are taking the students' levels of expertise into consideration. And this is really a time for us to look at what the acute care settings would call high risk, low volume at times. So there are events that are really important for students to learn, and yet they don't see them often. But if they do see them, they're very important to be able to address. So we try to take some of that pressure off the unknown, the what might happen kind of situation, and have them play that through so that they feel more comfortable if and when an event like that occurs. So as I had said prior, every clinical experience, except for the mental health, does have a skills lab with it at the very beginning prior to their clinical placement. We want to assure that students going into their clinical rotation have a sense of comfort with the basic skills. And certainly we realize that along the way, they're going to learn some other skills, probably within the areas that they're practicing. Students are assigned a lab kit at the very beginning of their clinical rotations, and that's yours to keep, and they bring it back and forth to the skills labs so that they have everything within one pack with their name on it, and that's theirs to keep and practice with safely. And that, again, is used throughout their time in the skills lab sessions. The very initial clinical adult health 1 has the highest amount. It's approximately 6 weeks of clinical skills. And those are our basic foundational nursing skills, the tasks, so to speak. And so those are done right at the very beginning. So students are going into the clinical setting, having a sense of comfort as they're starting to learn the communication process, the interpersonal skills along the way. How did you find, Taylor and Matt, think back to your initial clinical skills? How did you find that environment?
I thought that it was really helpful. There's so many different hands-on opportunities. It's one thing to sit through a lecture and learn the material, but then you have the skills lab, the simulation, clinical, the virtual reality, all those experiences really let you solidify those technical skills and make you feel comfortable to actually do them in a clinical setting and after you graduate as well. And the skills lab is, it's great because there's no penalties if you mess up or if you fail, and the faculty is always right there saying, oh, well, this is kind of how I do it. It might be easier if you try it this way. So it's really helpful.
Mm-hmm.
I found it very helpful, specifically just because I know a lot of people in our program were CNAs prior to coming into nursing school, and I didn't have the CNA experience. So going into the skills labs, I was learning everything new. So anything from inserting a Foley catheter or just repositioning a patient in bed, it was all new to me. So it really helped me feel more confident in going into my first day clinical and knowing more than I did, 3 weeks prior when I had, didn't have those 3 skills labs under my belt.
And that's a pretty common question. I think a lot of students have, do I need to be a CNA prior to coming in? Will I be able to do this if I'm not a CNA? And the answer is absolutely yes. And you definitely, you may see a different comfort level initially, but it certainly balances out getting into the program. So it comes with time like anything else. So you don't let that prevent you from being comfortable, because you'll get there for sure.
And many students become CNAs after they start the program, after they've had their first clinical that qualifies as a CNA course. So we can help students get certified and pick up a little part-time work if that's what they want to do.
I just got my certification like last week through the program, and I'm going to be working this summer as a CNA. So
great.
Wonderful.
So some more photos of the Interprofessional Simulation and Innovation Center. Looks like some nurse anesthetist students that are taking care of a person. And again, the simulators, these are very high fidelity mannequins. They have computers in them. They're that are connected to a control room, and the controller of that mannequin can alter the patient's vital signs, the patient's breath sounds, the patient's abdominal sounds. So students can listen with a stethoscope and really appreciate changes, and take a blood pressure and appreciate changes and make the appropriate clinical decisions based on how that mannequin is doing medically. So it's a very, very high-tech environment that really helps students make clinical decisions.
And we give students the opportunity to, put things on hold. They can say time out. If they just get to a point, sometimes people get stage fright and you lose the words or what your next thought was going to be. And you were prepared going in, but it just goes blank for whatever reason. And students can just say, time out, I step back, ask for help from the instructor, go through the thought process of what the next step is, because it's really in that environment where we're working with students and trying to build on their critical thinking and prioritization skills. Many times they have the information within them, but helping to facilitate what should go first, what the next step would be, that's what we're there for, to guide them through that. And students can oftentimes, depending on matching it up within the other graduate programs, nursing is such a huge collaborator with all disciplines that many times we're asked to work with other disciplines. So there might be an experience where there was a prior picture where there were individuals with white coats and they were from the pharmacy school. So if a student, puts a phone call in the room, so simulating an actual call to the pharmacy, they might be talking to a pharmacy student, or they might be calling for an order for their patient because something has changed. So they might be calling the College of Medicine student because these two are students learning. So it's a great team approach, and we try to use the interprofessional as much as possible because we really have a lot available to us on the campuses, which is really a wonderful thing to have.
Great. Thank you, Professor Hyde. So what you see in this slide is what we refer to as standardized patients. We use real live actors for some of our simulation that we do. Most recently, we've adopted this approach for our mental health simulation, and the students have been very, very happy with it. It's been a very distinct eye opener to the pathology of mental illness. And what you see in this photo here is one of the most remarkable ways for students to learn skills, and that's to practice on each other. And so this is a slide from our health assessment class where students are learning how to appropriately take vital signs. And taking blood pressure is something that requires a lot of precision. And so learning how to do it correctly on a real person is one of the best ways of learning anything. And so this is the virtual simulation that we talked a little bit about, the virtual reality. So you can see the student has the goggles on and is caring for a patient in a virtual reality world. And all of our levels of education are using this now. And so what we have are a number of patients built into this database that have a lot of different healthcare needs. And so again, we were the first school in the country to adopt this, and we are really doing wonderful things, and students are learning a whole new way with us. Community experiences are another real nice experience that the students engage in. We have everything from being able to do short-term healthcare immersion programs to service learning out in the community, working with a lot of different vulnerable groups, including the homeless, some of Maine's immigrant and refugee population, and a number of other areas. One of our hallmark programs is a program that is done at the Cumberland County Jail, training inmates health promotion practices, as well as the guards. And so a number of community-based experiences that are really, really rich for students. Mm-hmm. And like I said, these are just a few of what's offered. One of the hallmarks of becoming a nurse from our vantage point is really going through the curriculum, going through the program, really transitioning through all those clinical experiences, and then participating in that 135-hour preceptorship experience. Those are some of the wonderful transitions that nurses have. We also utilize a testing system here that is it's a standardized vendor, and there are 2 or 3 of them out there, and we contract with these standardized vendors to provide students with testing that is nationally normed, meaning we know how students are doing from the point of time that they start using this testing model. We know how they're matching up to students all around the country. So we have a very accurate predictive model of every student's chances of passing the NCLEX. And it's a really good thing to do for students because it helps them learn where their areas of deficiency are. It also helps them know where the areas of strength are, but it also helps us as a program know if we need to do some additional work with our programming. So these are some of the types of innovations that we have here in the School of Nursing and Population Health that helps our students in becoming a nurse. I talked about the preceptorship experience. I talked about the standardized testing. The National Student Nurse Association is another very robust student group that I'm going to have Taylor talk a little bit more about in just a moment, because it's a really wonderful early professional organization for students to get involved in. We also have a level of research and scholarship that students have a rich exposure to. All of our students in the four-year program take two evidence-based practice courses, and this is a difference than what most nursing schools offer, and it helps prepare our students for roles that involve robust quality improvement and research. They're prepared to participate on research teams when they leave this program. We also have a really tender, what I would say, student-centered advising model. So all of our students are assigned a professional advisor in the first 2 years with a faculty mentor. And then the last 2 years, they are partnered with a faculty member on the Portland campus. And none of our advisors have more than 20 advisees. So it's a very student-centered approach. Talked a little bit about some of the service learning that students can get involved in. This is actually a photo from a short-term immersion experience that we have in Ghana, West Africa, that takes place every late May. Unfortunately, we're not able to participate this year due to the COVID pandemic, but it's something that we do every year. We bring interprofessional groups of students, and we provide healthcare and related services alongside the Ghana Health Service in West Africa. And students will say that it is a remarkable, life-changing experience, and that's open to nursing students. Also, we have a third campus that is in Tangier, Morocco. And it is an opportunity that all nursing students can do in the fall of their sophomore year. They can participate in a semester-long study abroad experience at this campus. They can also study abroad in Spain as well. And my understanding is there may be a third site event coming up. But the Morocco experience is a very rich experience that students say is life-changing as well. Matt or Taylor, did either of you study abroad in Morocco or Spain?
I studied abroad in Morocco, and it was, I go off on a tangent, but the study abroad experience was one of the main reasons I selected UNE, because it is so hard to study abroad as a nursing major because you do need those lab experiences. And UNE has, the campus in Morocco is amazing, and they have dorms right there. So you're not staying with a host family like other campuses. But it definitely was one of the best experiences of my life.
That's great.
I was not able to study abroad, unfortunately, but I know so many people that are nursing students that study abroad. Both my roommates did, and they absolutely loved it. So I'm a little jealous that I was not able to, because I play soccer in the fall, so I wasn't able to. But still, I've heard a lot of really good things about it.
So Matt, you've just raised a really good point, and that is that we also foster the idea that we want our students to be able to play a sport if that's their goal. And the nursing program works very closely with coaches to create a learning environment where students can play their sport. And it's not unusual at all for students whether it's a fall or spring sport, to play all 4 years. And so we very much support students in sports, and that's also something that's not completely embraced in other programs, but we believe it's important. We also believe that athletes tend to be very well organized. Mm-hmm. So thank you for sharing that. Mm-hmm.
Yes, and faculty that have student athletes, we work very closely with the coaching staff as well as the athletics director. And some of the things that we help with are allowing students excused absences when they have games. And so that's really important. And we also have the preferred like clinical placements if times, afternoon, morning, really trying to work with the athletes to assure that they're able to attend their games and practices as much as possible. And that is definitely unique.
Right. So some of the travel courses that are offered include Ghana, Dominica. There's a travel course in Kenya. The one that's most medically focused or health professions focused is in Ghana, but students can really participate in any of the short-term travel courses as long as it coincides with their schedules. Here's another picture of one of our nursing students in Ghana a couple of years ago. Again, sports. I think we actually have 3 or 4 students from the football team that are in the nursing program right now. Yep. And we have a fair amount of field hockey students as well as soccer. Is that Matt Rainbow?
There's Matt again.
Oh, and there's a weight room. I don't know, Matt, maybe you can tell us a little bit more about sports.
Yeah, well, that picture that you're on right now, the slides, is our strength and conditioning room. So the athletes work very closely with our strength and conditioning coach. So we're in there a lot, but it is just a gym on the Biddeford campus as well. So students that aren't athletes as well, that are nursing students, their first 2 years can use that gym as well, which is a very brand new, beautiful facility.
Wonderful. Great. Thank you. More slides of the skills lab. Yep. So, there's so many wonderful things to say about this nursing program. I've been at UNE for 13 years now, and I've been the program director for 7. And the level of faculty expertise is second to none. We have faculty that have diverse clinical as well as research expertise. Students can find anyone in the department to talk about their expertise in a number of areas. And so we're really proud of that. We are accredited by the Accreditation Commission for Education and Nursing. That's one of 3 accreditors out there. And so we received our continuing reaccreditation 2 years ago. And so we'll be reaccredited in another 6 years. But we're very proud of that accomplishment as well. We have pass rates well above the national average. Right now, the national average, or in 2019, the national average was about 90%, and UNE's pass rate was 97%. We also have the highest 3-year average among baccalaureate programs in Maine. We are have been a recipient of several federal grants that actually provide a lot of programming possibilities for us. And so we've had about $3.5 million in federal funding since 2012. And that concludes our presentation. My name is Jennifer Morton, and I would encourage anybody to reach out to me directly if you have questions. They're also on your deck or view, there are a couple of videos that are available to you. One of them is Dr. Karen Pardue, our dean's welcome. There is a short trailer of the Ghana experience, if anyone's interested, as well as a former student talking about the program. And so,
Right.
Beautiful slide of a student studying. Can you imagine? Does that look really hard to take?
We are very lucky to have a campus right on the Hills Beach area of Biddeford in Maine. So I want to thank you all for all of that information that you shared with us. I hope for those students and families listening that it was helpful for you. We will take some questions from here, so please get those in. You can just type them in. If you're joining us on platform Q, you can get them in there. Also, if you're joining us on Facebook, hello, we see you. You can just type it in as a comment and we will get to those as well. Before we get to those questions, I just want to highlight a couple of the more virtual events that we have coming up in the next weeks. We do have a lot honestly planned for the next couple of months until we can invite students back to our campus. But for now, we're just doing some virtual events. For the accepted students on Wednesday, excuse me, what day is it? Does anyone know what day it is? I don't know. So on Wednesday, in a couple days here, we will have first year experience representatives coming to chat with you about what that first year looks like at UNE. And then the next week on Wednesday, on the 22nd, housing will be around to kind of talk to you about what housing and living on campus looks like at UNE, as it is a little bit different at every school. You can find that information. It will be emailed to you every week. All of our kind of lineup for the week will be sent to you. And then, of course, just visit une.edu/visit, and we will get you so that you know exactly what's going on. So here's how to follow us and kind of get in contact with us. We are at UNE Admissions basically everywhere. If you're an accepted student for this upcoming fall, then please join our Facebook group if you haven't done so already, UNE 2024. And then on Tuesdays, we have current students taking over on Instagram for Q&As. So definitely be sure to hit up all of those avenues for chatting with us and get to know a little bit more about UNE. So that's basically all we have there, but let's get to some of our questions. So let's start with, do students get different clinical settings each rotation? And I will pass that to Professor Hyde.
Sure. So we try to, sometimes students will stay at like Maine Medical Center. They might do a couple of rotations there because it does have the most available clinical rotations. But oftentimes students might do a rotation at Southern Maine Healthcare in Biddeford and then Mercy in Portland. So it's nothing, set in stone. Certainly students are welcome to request going to a different location, and we try to do that. It's a randomized grouping of clinical groups, and that way it gives students an experience with, working really interprofessionally within nursing students, but also different clinical instructors, different clinical locations. So we try to give students varied experiences for the med-surg rotation. Mental health, we have a couple of different areas that students do go to, and maternity pediatrics can be a wide variety of different locations, community and inpatient locations. So it's really a wide array of experiences.
And along those same lines, another question is, will they definitely get a hospital setting at least once?
Yes. Yes, they will. And Dr. Martin had mentioned, what's that?
They will get a hospital setting many times.
Yes. Yeah. And that's the thing too, that's really important to remember, wherever students are considering, is that when you're admitted to UNE Nursing, you are guaranteed clinical placement. So you will have a clinical rotation throughout all of those experiences.
Wonderful. The next question is directed at Matt. How difficult is it to be a student athlete?
Yeah, no, I'm a tour guide on campus. If you guys didn't know that as well, so I get this question a lot. Especially being a nursing student, it's not the easiest. Coming from like a multi-sport athlete in high school, I had a pretty strong base of like time management skills and everything, but those are really put to the test as a nursing student and an athlete. But there are so many resources that have helped me. SASE is really great. I learned a lot of time management skills from there, proper ways how to take my notes, and proper ways how to study. So with all of the help from my professors, from my coach and my teammates, definitely it is possible. It's not the easiest, but it is doable.
Okay, thank you. The next question is, what is the cost of the lab skills kit?
So there's no separate cost for it. It's included in the cost of the education. It's not anything above and beyond.
I would add to that UNE, as we don't charge lab fees at all. And so, you know, one of the things we really feel strongly about is that students don't get blindsided by added costs every year. So obviously books are a cost, and that's what students need for. So there are no lab fees built in at all.
Good point. Good point. Do clinicals start junior year?
Yes, junior year is when they start. When they come up to the Portland campus, that's when they will start the immersion into the clinical setting, starting either at the New England Rehab Hospital or one of the skilled nursing facilities in the Portland area.
All right. The next question is, do you have a percentage of the students who pass the NCLEX on their first take?
Yes. So in 2019, our pass rate, our first-time pass rate was 97%. I can go back. 2018 was 98%. So we've had a 3-year run of the upper 90, well above 96%. So
It's going to be 100% this year.
Yeah, we might do that.
All right. Next question. So maybe Matt or Taylor, you could talk about this. With how busy junior and seniors are, do you think that nursing students could get a part-time job working at a hospital, at a desk, et cetera?
Yeah, so I currently have 3 jobs all through UNE, through work study and just on campus in general. And a lot of them are like, I'm a tutor in SASE, so I can't do homework then, but I also work at the front desk in SASE, which is our tutor center, where I can do work. So it's definitely, you really got to do really well with your time management skills. And certain semesters are busier than others, but it's definitely doable.
Yeah, I also have a job. Obviously, like I said before, I'm a tour guide at the university, so I have that part-time job through UNE. But also, starting this summer, I'm going to be living in Portland, and I have a CNA position on one of the floors I did my clinical rotations on. So I plan on keeping that per diem job throughout my senior year so that I can pick up shifts as well along with that. So being per diem, it's pretty easy. I can get nursing experience as a CNA while taking classes and doing my actual clinical rotations as well. So that's definitely doable as well. I know many people that do that in Maine Med and in Mercy.
And as faculty, we know that students need to work. We also know that students enjoy working, and that oftentimes a targeted amount of work makes them a better student. Now, that said, we would never encourage students to work more than they can. And what I mean by that is work to the point where it interferes with their academic study. But work isn't a bad thing if it's in moderation. Yeah.
All right. Our next question, again, Matt and Taylor, maybe something that you can talk about. What was the transition like from the Biddeford campus to the Portland campus? How did you adjust?
I love the transition personally. So the Biddeford campus, I know it was mentioned, is our undergraduate campus. So that's very typical. You live on dorms, you eat on campus, you're kind of always on campus. But when you go to the Portland campus, like they said, you can live in the housing in Biddeford, but there's no housing at the Portland campus. So most people are getting apartments, and it's a graduate campus. So it's just a very different feel. And I personally enjoy that experience a little better, where you go to classes during the day and then you kind of get to go home and you have that separation and you're actually living on your own independently. But I thought the transition went really smooth with all the resources they offer us.
Yeah, I would have to agree with that. With making that transition this past year, I was a little nervous just because it is totally different from the Biddeford campus, but it was a lot smoother than I expected. As being a part of the Student Nursing Association this year, Taylor and I both are. The last year when I wasn't a part of it, they hold a sophomore kind of step-up day, so they can tell the sophomores what it's like on the Portland campus, what you can expect for classes, and how to dress for class, and how to take the shuttle, and everything that we have to know the ins and outs. So they really want to make sure that we have that kind of seamless transition, and it really was. So I thought it was really a good transition.
And the people that put that on is the Student Nursing Association, or SNA, and that's a actually group that Matt and I are both part of. And it's run by nursing students, and anybody can be involved. And it's just such a great way to get involved with the community and with other majors. And they really, the group, I think, really sets you up and gives you all the resources you need.
Great, thank you. Really quickly, I just want to let everyone know we have about 5 minutes left in our chat tonight. If we don't get to your question, it's okay. You can shoot us an email, admissions@une.edu, or you also know how to find us on other social media. I do want to just make 2 quick points, just a couple reminders. For those students who have been accepted for this upcoming fall, first of all, congratulations. Second, we did move our refundable deposit deadline to June 1st. So usually it's May 1st, but given everything that's going on this year, we pushed it out to June 1st. So it gives you a little bit more time to make a decision. And then also we are still accepting applications at UNE for this upcoming fall. So if you're interested in starting with us for fall 2020, get in touch with the admissions office and we'll walk you through it. We'll help you figure out a good path for you. A couple more questions that we have here. I know it's been kind of touched on a little bit with the SASE, but what kind of academic support is offered for students?
So I'm happy to answer that question. We have an office called the Student Academic Success Center, and it's a student support system that is really, I refer to it as academic health promotion. I think it's a place where students can go even when they're feeling like they're not in trouble academically, but it's also a place to go for tremendous academic support when students are feeling a little bit like their classes are difficult for them. There's one-on-one testing support. There is tutoring. I think I heard Taylor say that you actually work there, Taylor?
Yeah.
In the SASE Center. And so we have our own students that serve as tutors for underclassmen. And so the SASE Center is a wonderful asset to UNE. And nursing students are very consistent customers, and not for any other reason, in that they strive for excellence, and that student support is very helpful in that regard.
I can attest to that because Taylor's my tutor. So Taylor and I worked very closely this semester. She helped me out a lot. It's really good to have a tutor who is a year above you, who went through this last year, and she would walk me through it because I didn't do as well as I wanted to on my first nursing exam going into one last fall. So when I met with Taylor, she kind of walked me through it, kind of how the testing styles are different, and it definitely helps me a lot. So that's great.
Cool. Thank you. All right, and then we'll get our last question in here. It's a good one. Can you talk more about the virtual simulation and how it compares to live simulation?
So as students, have you both had the virtual simulation? So you actually, if you don't mind talking about that, and I'll talk about something a little after that, comparing them.
Yeah, so the virtual simulation, the virtual reality was really cool for me. I had never actually used virtual reality goggles ever before. I just never really had a chance to use them. So it was a whole new experience for me to be able to step into a patient's room, but virtually, and have all of the options to do different interventions, do different lab tests, start IVs. You know, I could call the doctor or the pharmacy or look up the patient's charts. It was really cool to see that go through the simulation and then get about what I didn't do right, what I did do right, and everything along those lines. And we have a whole post-conference with it. So we talked about it with our clinical instructor and our entire clinical group. So to have that opportunity was really cool. I wasn't sure what it was going to be like going into it, but I was very glad that I did it coming out of it.
Yeah, and then the live simulation is really cool. You do it with your clinical group, and they kind of watch you as you do it to learn from it. But you're in a room with a mannequin who can do anything. It'll speak to you, tell you what they're feeling, their vital signs change, and it's a really, really great experience, both of them.
Yes, I like the live simulation too. It's a different feel. There's definitely a little bit more pressure, but your clinic group is watching you from the next room over, and they're cheering you on, and they're like, "Don't leave the bed rails up," or like, "Don't forget to listen to the lung sounds and everything." So we're really supporting each other throughout it in our clinical group, and it's a really cool way to be able to practice our skills in a safe setting.
And the virtual reality, the student is really the driver versus the live simulation, where nursing faculty can manipulate the setting to make it more student specific. So this is where, and we also have a unique model where our clinical instructors, and we didn't really touch upon this, but our ratios are, under 8:1 in a clinical setting. And so that, allows the clinical instructor, who is typically native to the unit where the students are going with them, so offering them a really good learning experience. They come to the simulation center with their clinical group, and then they discuss and talk with the clinical faculty running the school faculty running the simulation. And so they may notice things that might be something the student needs to work on, or maybe a little more confidence, or a certain skill that they need a little bit higher performance. So we can tailor the live ones much easier than the canned, the VR. And if people have difficulty with the VR, with the motion sickness, there's also availability to do it on a flat computer screen. So we don't, we wouldn't force them to do that.
Wonderful. So that is all we have time for tonight. I want to thank everyone for joining us. So students and families that are watching, thank you so much for taking time out of your evening to join us. And thank you to all of our presenters for sharing your knowledge of our great nursing program. I really appreciate it. And for all of you listening, if you'd like to get in contact with us, again, admissions@une.edu, or you know how to find us on our social media pages. So we hope you are well, and please let us know if we can help with anything in the future. All right. Good night, everyone.
Thank you. Have a good night.